So we are talking about the management of decay. Decay is nothing but ketoacidosis. Decay is nothing but diabetic ketoacidosis. What happens? The sugar levels are more than 250. In decay, there is high anion gap metabolic acidosis in decay, and also there is one more thing called as ketone bodies present in the urine, and there's a fruity odor from the mouth. Okay, so this is decay. So the correct management will be, you have to give IV fluids, lot of IV fluids you have to give. And which IV fluid? Intravenous 0.9% NaCl, 10 ml per kg. And subcutaneous you have to give insulin, regular insulin, 0.1 units per kg per hour. Patients who are nauseated, vomiting, not alert should be dehydrated with IV fluids. We should not give paroral fluids because since they are not alert, there is a chance of aspiration. Okay, so therefore fluids should be given by IV route. So since they are dehydrated, fluids are indicated. If they are recently vomiting, we suggest paroral fluids may be ineffective and they are not alert, therefore will be unable to safely swallow. We should give IV fluids. This therefore means paroral fluids plus subcutaneous insulin plus paroral fluids plus IM insulin are both wrong. So note also that insulin should be given subcutaneous, not IM. Okay. So if they are alert, not nauseating, not vomiting, you can give paroral. Okay. Yeah, don't give subcutaneous, have to give. Don't give IM subcutaneously, have to give. Subcutaneously, it will go into your lipids, subcutaneous tissue, which is fatty layer, no? Full of subcutaneous fat. So then the subcutaneous tissue you have to give. What is the angle? Tell me the angle of subcutaneous. 45 degrees. 45 degrees. And if you are giving at 90 degrees, that is IM. Okay. Additional practicalities information: dehydration in children should be corrected over 48 hours, as rapid dehydration may lead to cerebral edema, and insulin should be started after IV fluids have been running for 1 hour. A is incorrect, as resuscitation fluids should be 0.9% NaCl, not dextrose. Okay, don't give dextrose. Now talking about mild raised creatinine. So mildly raised creatinine is a sign of dehydration which is often seen in decay. Decay, you will see mildly raised creatinine. So talking about the decay, in decay there is a raised creatinine due to the okay, and bicarbonate is low in decay because the ketones use up all the bicarb. So bicarb will be used up. Potassium is usually high due to acidosis and lack of insulin. Lots of potassium remains in the blood rather than being moved into the cell. So potassium levels will, after giving insulin, you should monitor potassium levels because there will be sudden drop in the potassium levels. Sodium may be slightly low due to dehydration, but it can also be a normal. Only having questions and questions, there is answer. With this question, only answers and answers. Measles.